As you have tried and failed pills, injections, and vacuums, this is the next step in the treatment of erectile dysfunction. In your journey of ED, the highest level of satisfaction rates will be with the penile implant. This may be a scary procedure to think and go through, but trust me, we'll take very good care of you and we'll make sure that you have an excellent outcome. During the procedure, you'll be given an anesthetic and fall asleep. Once you're asleep, we will shave your genital urinary hair. After we shave the hair, we then numb you. After you're numb, we'll then proceed with performing the penile implant surgery. In general, I tend to place a drain on the opposite side that the reservoir is placed. You will be wrapped up and your penis will be wrapped with Curlex and Coban. This dressing is to be removed after 2 days and the drain is usually removed a day later. Talk to your doctor about what clearances are needed. In general, patients that have issues with their kidneys probably need a nephrologic clearance. Patients that are diabetic may require medical clearance or hemoglobin A1C levels. While these are not hard and fast stop clearances for me, depending on the number, it may help you to have controlled blood sugars for better wound healing. In general, if you've had any cardiac history like heart attack, coronary artery bypass grafts, or stents, we generally require cardiac clearance. The penile implant surgery is generally an outpatient procedure in the hospital or a surgical center. The surgery itself takes about 40 minutes itself. Generally, the penile implant surgery is an outpatient procedure and you will need transportation to and from the procedure itself as the patient undergoes surgical procedure with general anesthetic. I recommend that patients use a vacuum erection device or a penile stretching device for approximately 4 to 6 weeks before surgery. This has been shown in several studies to increase penile length and overall helps with post-op pain and has also been shown to increase penile length of the penile prosthesis. In general, I also recommend that patients pick up ice and scrotal supports. For the first week or two, it's beneficial to be icing every 30 minutes to an hour 4 times a day, minimum, and also using scrotal supports to help out with swelling. I also recommend that the night before to purchase Hibiclens or chlorhexidine and scrub off the scrotum and genitalia the night before. We will scrub you in the operating room, but it's also beneficial for you to do this before we get there. I also recommend that you do not shave your scrotum, penis, or genitalia area at least 1 to 2 weeks before surgery, as you may cause skin cuts or pimples or infections of the skin, which would cause us to cancel your surgery. In general, follow the directions from your healthcare provider in regards to what medicines you should take and should not take. In general, if you're on blood thinners, defer to your cardiologist or your urologist performing the procedures if you should stop them and for how long. If you're diabetic and you need to take other medicines to control your blood sugars, talk to the anesthesiologist and your urologist to figure out what are the appropriate doses and when they should be taken based on when your surgical procedures will be performed. In general, the penile prosthesis surgical procedure is performed under general, which means that with general anesthetic on board, the patient will not be able to eat or drink at least 8 to 12 hours before the surgical procedure. Check with your urologist and also the anesthesiologist and the particular requirements in your situation. In general, I tell my patients to bring their scrotal supports to the surgical procedure itself, as they will wake up and need that scrotal support when they wake up. It's also useful to bring an ice pack and also loose-fitting pants, as in general, you'll be left partly inflated when you leave, and it's better to have sweatpants and also long shirts to help out with the effect that you may have an erection in your pants, depending on what surgical procedure you have done. I would not shave at least 2 weeks before your surgical procedure. If you do, you can get skin infections, skin cuts, cellulitis, and cause us to cancel your surgical procedure. We will shave you while you're asleep for the surgical procedure. This also helps to make sure that we can prevent any cuts or infections, as it's done sterilely under the operating room lights. The day of surgery, you'll be checked in by the nurses. Once they get you checked in and gowned up, we'll then put IVs in and start your antibiotics and your antifungals. Once they go through your medication list and everything, The anesthesiologist and CRNAs will then chat with you. Once they have chatted with you, I will come sit down with you and answer any and all final questions you have. We will also do a penile stretch test by stretching your penis out to show you your stretch length and inflated length at the end of the case. We will discuss the surgical approaches and which one's right for you. You will then go back and get your surgical procedure and wake up. In general, most patients have little to no pain once they wake up due to the anesthetic that we use generally and locally. We will then check on you to make sure everything is good and that you are doing well prior to your discharge. It's normal to be nervous when you're getting a surgical procedure, let alone a procedure on your penis, when we're putting a device in it. This is normal. Talk to me and talk to your partner. We also have patient advocates that you can talk to as well about ways that you can walk through nervousness through this. We'll work through this together and try to make sure that you have a good outcome and good surgical cosmesis. If you have questions about the surgical procedure itself, the steps, and what's going to happen both during the surgery and afterwards, call the office and set up a time to chat with me or an appointment. If you have questions about the anesthesia and the anesthesiologist and what they will use, call the facility that you're getting your procedure done at so we can see if we can get those questions answered before the day of surgery.